Hello, I'm Elena Bertozzi. I'm a physiotherapist specializing in pelvic floor rehabilitation. I'm author of several scientific articles, university professor, trainer. I will tell you about the treatment of very pelvic dysfunction with oxygenal therapy. Okay. Now I speak about vulvovaginal infection and a new proposal with oxygenal treatment. A condition that I often find myself dealing with my patient is relapsing infections. Many times they have already made long pharmacologically journey. The goal is to find alternative strategies in the treatment of recurrences. It's very important for me to resolve recurring infections because they are very often the main causes of other pelvic pathologies such as vulvodynia, neuropathy, vestibulodynia, hypertone, and dyspareunia. Vaginal infections are conditions of an infectious nature that affect a woman's vagina and vulva. We know that vaginal infection can be due to bacteria, fungi, parasite, or virus. I leave you here in this slide the main characteristics of the most frequently pathogens. Several factors expose you to infections vaginis. Among these are, for example, sexual promiscuity without protections, the inappropriate intake of antibiotics, the use of thick-fitting chlorides and underwear made of non-breathable synthetic material, and the other. We have many types of symptoms. In fact, it's very important for us understand what type of infection are for make a correct treatment. In general, vaginal infection can cause white cottage cheese-like vaginal discharge. Alternatively, vaginal discharge could be yellow, green, and smell like fish. Intimate itching, pain, pain during sex, pain after sex, pain during urination, pelvic pain in general. In this slide, you can read the most important pathogen that we can find in our patients. For example, Candida albicans. We know very good Candida albicans because it's very frequently is a particular mycete. We can have many symptoms, in particular the itching. Another frequently pathogen is Gardnerella. Another is Mycoplasma. We can find this different type of pathogen with a tampon. It's very important, this diagnosis. Trichomonas vaginalis is very important, this type of pathogen, because the transmission is sexually. Herpes is a virus. We have two types. In women, genital herpes, for example, can be associated with vaginal infection. For the treatment of relapsing infections, I decided to propose in this study a non-invasive and painless treatment such as oxygenal therapy. The idea comes from the knowledge of the beneficial properties of oxygen. I thought they could be suitable for this type of treatment. The properties of oxygen that are very important for the infection is bactericide. I think that is the most important effect that I use in this study. Oxygen therapy is useful in anaerobic and aerobic infections. The effect bactericidal, the action thanks to the production of free radicals of oxygen. The bacteriostatic action can be explained above all thanks to the activation of the pathogenic function of the polymorphonucleotide cells. Another properties of oxygen very important for the infection is biostimulation and anti-inflammatory. The oxygenal therapy was used in different type of problem. For example, for reduce inflammation and positively influence structural protein in healthy infect human skin. By literature, we know that the oxygenal therapy is very good for the repair, for the anti-inflammatory, and for regeneration. In this study, we used the oxygenal therapy added with hyaluronic acid. For different reasons, for increasing collagen synthesis, for stimulated fibroblastic metabolism, promotes neocollagenogenesis, and in general for regeneration of the vaginal mucosa. For the relapsing infection, is very important for us the therapeutic effect of oxygen for created barrier and protection of vaginal walls, for example, during sexual microtrauma, increasing the state of vaginal well-being, lubrication, promote the vaginal environment by increasing the proliferation of lactobacilli and good bacteria for the protection, reduce inflammation, reduce burning, and therapeutic alternative, because the most problem is that we haven't another type of proposed for our patient after pharmacological intervention. The protocol that we use for this treatment is vulva and vaginal oxygenal and hyaluronic acid. In the first phase, we use airbrush for external oxygenal treatment. Why I decide to use external treatment? Because I need to treat the symptoms like burning urethral, burning symptom or symptoms of cystitis, increasing barrier and decreasing vulvo-urethral inflammation. And the possibility to use external treatment is very important for this time of problem. In the second phase, I use the cannula for the internal vagina treatment. And in the third phase, I use the oxygen and hyaluronic acid solution. We can show that the symptoms of urethral burning in recurrent infection are reducing very much. These symptoms, urethral pain, is very frequently in this patient. And it's very important for me reduce this symptom for that patients. Another problem is releasing it, and it's very important for me reduce this infection after 3, 6 months or 12 months. And we know that in the 55%, we can reduction of recurrence at 6 months. The beneficial effects thanks to oxygen are bactericide effects, increased barrier, increased lubrication, and decreased dryness. All these are important for reduce of mycotrauma that are the causes of infection. In my experience, it's very important to give to our patient another type of treatment, non-invasive treatment, not painful treatment, and not pharmacological treatment. With this type of treatment like oxygenal therapy, we can resolve for a long time the reconducing infection. It's very important give to our patient good strategy for daily life and recommend one treatment a month for 6 months after the end of 5 or 10 sections during the acute phases.